Hello, and welcome to the GRACE podcast series. My name is Denise Brock, and I am the Operations Director for the Global Resource for Advancing Cancer Education, or GRACE. In this podcast series, we interview patients, advocates, and healthcare professionals to provide the most updated information for our community and to highlight important issues facing those dealing with a cancer diagnosis. We hope you find this information valuable. For questions or comments, please visit us at cancergrace.org.
So another question, how effective are liquid biopsies at detecting TKI resistance for resistance for fusions like ALK, ROS, and RET?
So I'm happy
go ahead. Sorry.
I'm happy to answer this. So this is actually one of the areas I study as far as research. And so you saw Dr. Weiss's slide about how it can be easier to detect kind of a point mutation. And as you get to finding more complex things like rearrangements, the testing strategy has to be decidedly more sophisticated. That's also influenced by how many different types of fusions one can have. So for ALK fusion, which you'll learn about, the partner for ALK is often always the exact same gene. So it's easier to make a test that says, I'm going to look for these two proteins stuck together, or two genes stuck together. For ROS, RET, et cetera, it becomes a little bit more advanced. And so as you add layers of complexity, the sensitivity or the yield of the test decreases a little bit. So you're more likely to have a false negative. But I'm happy to say that with the way that liquid biopsies are advancing, all of these tests are becoming pretty decent at picking up fusions, rearrangements, point mutations. I think one layer that becomes more complicated is that when you're looking at whether or not something is present in every single cancer cell versus only in a subset of cells in resistance, it can be harder. So if you imagine that you've been on a therapy, you have an EGFR mutation, and then you get a fusion at resistance, that fusion is only present in a fraction of cells, which is even harder to detect with an assay. And so all of these factors kind of play into whether or not the yield of a circulating tumor DNA biopsy is going to be as effective as you want.
So the quick answer is sometimes.
Yes.
So I think this comes to patient values, right? So here we are spending our Saturday together at a patient forum. Obviously, the folks here are going to be the most empowered, aggressive, motivated patients to an extent. Not every patient comes with the same values, right? And I think we do need to be honest here that when, we don't always find something usable, right? When you get to ALK, to ROS, to RET, I'll be honest, I think it's far less than half of the time that we look that we're actually going to use it to help the patient, right? Often the answer is the same regardless. I'll say the same for ALK, where we often get an answer, but what we do actually doesn't change the overwhelming majority of the time. And so I think for a patient who comes in asking the question, I don't have to have a needle stuck in me, do I? The answer can be no, we'll move on to next line and we'll get this liquid test. But for the patient whose values are, I want to do everything I can to stay on the most effective targeted therapy, I'm open to off-label uses, I'm open to trials, then I think those values, once expressed, increase the merits of going after tissue and going after more aggressive testing because you're now empowered to do something with it.
Thank you again for joining us. This podcast was made possible by the generosity of sponsorship from our friends at Lilly and Exelixis. Please like and follow us on Facebook and Twitter. Send us feedback, share your story, donate, and visit us for more information at cancergrace.org. Thank you for listening.